The number of people waiting more than 4 hours in accident and emergency departments in Scotland reached a record high in the last week of 2017. New figures show only 78% of patients were seen within the government's 4-hour target, the lowest proportion since weekly data started being published 3 years ago. Here's our Scotland editor, Sarah Smith.
Busy accident and emergency departments in Scotland mean patients are facing their longest recorded waiting times. Last week, over 100,000 patients waited more than 4 hours to be seen. Nearly 300 waited longer than 12 hours. Figures described today as a disgrace.
The figures out today are for the week ending in Hogmanay, a very, very challenging week for our health service. Flu really beginning to kick in that week. For example, 40% increase in calls to the Scottish Ambulance Service on Hogmanay alone. And of course, our staff working extremely hard on the front line to keep patients safe.
In the week between Christmas and New Year, only 78% of people visiting A&E were seen within the target of 4 hours. That's compared to 92% for the same week the year before. The delays are not because of increased patient numbers. Only 635 more people attended A&E departments. One reason given for the increased waiting times is a surge in flu infections. Cases of flu in Scotland are running at more than double the rate in England, more than twice as many as there were last year, and that's now a significant concern.
I just wasn't sure.
Patients with flu take longer to assess and require treatment in individual rooms as staff try to minimise the spread of infection.
The team have had to work extremely hard all the way over Christmas and the New Year period.
Worse than before?
I would say so. I've been doing this job for many years and I think it's probably one of the busiest times we've had.
The Health Minister, visiting a hospital in Perth, insists the Scottish NHS is performing well overall, with far fewer cancelled operations than south of the border.
Oh, hi, Mary.
In Lanarkshire, some of the NHS admin staff have been volunteering on the wards to help the overstretched nurses.
I was a bed buster.
What's a bed buster?
It was basically going and helping the ward staff to strip down the beds after a patient had been discharged so that it's cleaned and made up and ready for the patient to come into, and do that as quickly as possible to save the nursing staff doing it themselves.
I'll put that on your finger there.
NHS spending is significantly higher in Scotland, about £160 more per person than in England. Greater integrated health and social care is meant to mean fewer delayed discharges, less bed blocking. But today's figures show that the winter health crisis has hit Scotland hard. Sarah Smith, BBC News, Perth.